Pozdravljeni v bistvu strani mene pa Blaža, bova probala malo voditi en tak pogovor. Na začetku samo mogoče par uvodnih besed. Torej v bistvu gospod Marin Polonjo je magister fizioterapije s specifičnim delom v športni in pa ortopedski fizioterapiji in je v bistvu enoletno strokovno pripravništvo opravil na ortopedski kliniki Lovran, kmalu zatem pa se je zaposlil v zasebni ortopedski bolnišnici, dr. Nemec kot glavni fizioterapevt. Vzporedno z delom v bolnišnici je delal tudi kot glavni fizioterapevt nogometnega kluba Reka. Ob delu v bolnišnici in klubu je opravil več tujih izobraževanj iz športne fizioterapije, manualne ortopedske terapije ter gostoval in bival na tujih klinikah na Švedskem in v Nemčiji. Potem je pa nadaljeval svojo karierno pot v enem izmed najboljših klubov v Aziji in sicer v Združenih arabskih emiratih, kjer je nadaljnjih 5 let delal kot fizioterapevt prve nogometne ekipe in osvojil več lovorik, med drugim finale Azijske lige prvakov oziroma finale svetovnega klubskega prvenstva leta 2018 z Real Madridom. In med tem delom v Emiratih se je v Evropi in tudi tam dodatno izobraževal na specifičnem področju športne in ortopedske fizioterapije, ki ga zanimajo preko raznih delavnic, tečajev, seminarjev in kongresov. Leta 2019 se je pa vrnil na Hrvaško, spet v bistvu s prvo ekipo v Reki, kjer je bil v nogometnem klubu glavni fizioterapevt, hkrati pa je postal tudi predavatelj na fakulteti za zdravstvene študije na Reki pri predmetih športna fizioterapija, fizioterapevtska ocena in veščine. Vzpostavil je sodelovanje med nogometnim klubom in fakulteto in pač pri organizaciji klinične prakse študentov v profesionalni športni ekipi. Hkrati pa vzpostavlja tudi sodelovanje med tehnično fakulteto tam na Reki in nogometnim klubom, ki je na osnovi razvoja programskih rešitev za spreminjanje in analizo poškodb igralcev ter v bistvu vrednotijo neko okrevanje po poškodbi do vrnitve na nogometna igrišča. Torej, to je bilo zdaj neko ozadje, zdaj bomo pa v bistvu čez razna vprašanja ga lahko malo več izvedeli. Bi pa samo še rada dodala, če ima kdorkoli kakšno vprašanje, naj ga kar napiše nama z Blažem v chat, pa bova prebrala, ko bo opcija. Ok, zdaj pa predajam besedo Blažu.
Torej, pozdrav tudi z moje strani. So this whole meeting will be conducted in English, so the students will be able to better understand everything we are talking about. So these were some words about your extensive career as a physio. Is there anything you would want to add to that? Did we get the whole picture, your whole pathway?
Yes, I would like to add that first of all, thank you for me to be invited on this meeting. I'm grateful to help you as a young students. This is also my idea to help to the younger colleagues to find their own way in the physiotherapy in the future. So I'm really thankful for your inviting me. I would just add that now I changed the club. I'm back in Dubai. So I just came 3 days ago. So I'm speaking with you from Dubai. I just changed the club. So I got invitation from one coach in Croatia, and he's the head coach in Al Nassr football club in Dubai. And so I'm back in the UAE. This is new.
Yeah, it's the club that Cristiano Ronaldo is playing for, Al Nassr, is it? Or is it
no. It's the same name. But
it's the same name. Yeah.
This is the United Arab Emirates, and Ronaldo is in Saudi Arabia. So
okay.
But the name is the same.
Oh, okay. Okay. So yeah. Otherwise, I would like to talk about your career beginnings and how you started at an orthopedic clinic in Lausanne as an intern, if I'm not mistaken, and later on at orthopedic hospital to Dr. Nemec. Can you talk to us a little bit about that? How you started there as a physio?
Yeah, well, in orthopedic clinic Lovran, as you know, I don't know how is the law in Slovenia, but in Croatia, you have to go for 1 year clinical practice after bachelor degree, because you need to have license after that. And then it was 1 year of internship in the hospital. And I was really lucky that I got in the orthopedic clinic. So I was 1 year, full 1 year, only in the orthopedics and orthopedic trauma. So this is something what in Croatia we have to do it. I don't know how it's in Slovenia, but so I was there for 1 year internship.
Okay. Yeah, we have like half a year, I think, of an internship, and then yeah, you're a fully competent physio.
Yeah.
Yeah. And you were already in sports back then, or did you came across sports later on? Yeah, can you talk us a little bit?
Well, I am also a recreational athlete, so I do sport by myself, and also as a man physio. I think everybody wants to work in sports. No offense to the ladies, but you know, as a men's physio, you really want to work in a handball, football, because football is the most popular in the world. So yeah, it was always my dream to be physio in the football, and I was thinking about that to come to football, but I started to work in football the same period when I finished my internship, because I got invitation from one colleague if I would like to come to the football club Rijeka to join under 19 team and to be their physio. So I was really happy that my colleague recommended me for that job, and at the same time also Dr. Nemec, maybe a few months later, also called me with recommendation from orthopedic clinic Lovran. So yeah, I'm thankful and happy that people in that period already recognize my ambition, my passion to that work. So really, all of my jobs I got by recommendation. So that's how it goes.
Yeah, that's really interesting. So you were talking about the starts at Rijeka at under 19.
Yes.
So how did you then progress through the ranks, and what were your area of expertise there at the club?
Yeah, well, it was just the beginning, you know. I had a lot of energy, but I have to return a little bit back in my students' day. When I was first year of physiotherapy, of course, during the morning until afternoon, you are having your lessons in the faculty, and then in the afternoon, around 4 or 5, every day I went to one private physiotherapy clinic as a volunteer. So because I was really interested in their work, that's one clinic in Rijeka, private clinic, and I stayed there for 1 year just volunteering. So when I was student, and I think it was difficult because I was in the university until 2 or 3. Then I got quick lunch, and then coffee, and 5 o'clock I already started to work until 9 in the evening. And it was 1 year like that. So I was studying in the night, doing my studying time in the night, I don't know, midnight or so, and then, you know, just for 1 year like that. So I just want to say that you have to sacrifice your private life if you really want to reach something, and then that passion people recognize. And after I got present from my colleagues who recommend me on all of the jobs. So this is the big honor that always in my jobs I got recommendation from the physiotherapist or the doctors, never politics.
So it's the passion that really that has really done it for you in a way. Yeah. So yeah.
Everything what you do, you have to do with the passion. So then you will be happy, and then people will recognize that, and then you will reach the point what you imagine in your life, what you want to be, or where you want to go. I mean, it's very simple.
Yeah. Yeah. So what did you do exactly in Rijeka? Did you prepare footballers to a game, or did you only treat the injured ones? What was your work like there?
Back then, in the beginning.
Yeah, back then, yeah.
Okay. Yeah. Well, I was not able to be there every day because of full-time job in the hospital. So I can tell you my weekly schedule, so you can imagine better. So usually on Monday, in the private hospital, they did big surgeries like knee replacements, hip replacement surgeries, and then usually Monday morning they don't need me because they're just doing surgeries. So usually I came to hospital like 2 or 3 p.m. Then I stay there until 8 in the evening, just to transfer the patients from the recovery room to the apartments, to their because in private hospital they had only 2-bed apartment. So that's what I did on Monday. After that, I went to the club because usually under 19 they train evening at 8 because their kids still going to the school. So usually they train 8 evening because school finished at 7:15, I think. So then I was until 10:30 in the club, and then on the Tuesday I'm all day in the hospital. So from 7 in the morning until 8 in the evening, so like 13 hours. Then Wednesday the same, only hospital. Then Thursday from 7 in the morning until 2, I think until 2, because back then I started my master when I was working. So from Thursday 2 until evening 7, I was in a faculty for the lessons. Friday I was all day at the university because of the master, and in the evening I came back to the club to check all the players, to see if everything is okay. I'm all with them during the training session, prepare them, everything. I check if somebody cannot play the match on the weekend and something like that. Then on Saturday, if we played at home in Rijeka, I was still in the morning at the university, and in the afternoon with the team on the matches, if the match is on Saturday. If the match is on Sunday, then on Sunday I'm only with the footballers. And yeah, if you play away, usually we play on Sunday, so Saturday morning I'm with the team, Then we travel in different parts of Croatia to play. The next day we play the match, and then Sunday it's the match time. You come back late night, and then starts Monday.
Wow, that's quite a schedule you had when you were a student.
Yeah, it was really, really heavy. Yeah.
Yeah. So you mentioned master's degree. So how did you decide that with everything else you wanted to do a master's in physio?
Okay, because in Croatia only Rijeka is having a faculty of health studies, which is part of the university. I think in Zagreb, you don't have university level of physiotherapy, and then it's a difference. Of course, maybe I would go to Zagreb if in Rijeka they didn't open the master program. But I was lucky because they opened in Rijeka and it was part of university, and you got university diploma, and it's a big difference for the future when you wanna go on the PhD or something like that. So yeah, I was quite on the edge because I just got 2 years of clinical experience, and to join master program, they got criteria that you had to have minimum 2 years of work in the physiotherapy. So I was really on the edge. I was having 1 year from the clinic in Lovran, and then almost 1 year in the private clinic of Nemec. So I was the youngest in the master program because everybody else already had many years of experience in physiotherapy and certificate that they worked already in physiotherapy. Yeah, how I decided? Well, it's in my city, it's close to me, so I said to myself, I will manage somehow. I don't know, even me and my colleague wrote seminars in his house. He had small kids. I helped him to put them in the bed, and then we continued to write seminar until 1 in the morning, 2 in the morning. So, and the next day you are working, and that's it. You know, it was difficult, but you have to push yourself. I mean, you have to be how to say, masochist.
Yeah. So how should I say? Can you tell us a little bit about the Croatian First League? You were at the junior team, so under 19. So what was the league like? Was it really hard on kids physically? I mean, yeah. Can you talk a little bit about that?
Well, the league it's good. I mean, there are many good players already in the under 19, and also in that age, many of that also from Rijeka went to national team. So yeah, well, you play. It's the same like the first like the senior group. You play with all the big clubs in Croatia. You travel to Osijek, Split, Zagreb, Varaždin, Pula, Šibenik, everywhere. So it was good experience, and I met a lot of coaches, a lot of colleagues, and every time when you travel, you try to find out how is the situation in their club, how they manage to do some studying or some informal education outside the club, which is very important. When you work in football, you don't have much time to go on some extra courses. Of course, also you have to pay for those private courses if you want to learn about manual therapy, sports physiotherapy, kinesiotaping, neurodynamics, DNS, LMB, or many other courses. So I was always curious how if they're invest in themselves or no, because I think that every physio should invest 10% of their salary for new knowledge, for new education. That's my idea, how I worked.
So I was wanting to ask you about it, about the extra courses that you were doing at your first years as a physio, and after that, which were the courses that you took and why?
Yeah, first, I was very, and I'm still interested in manual therapy. So the first courses I did, it was manual therapy courses, Kaltenborn Evian. It's the Scandinavian school of manual therapy. And I think it's really high level school for manual therapy. And I got German German teacher. So yeah, I prefer to have foreign teachers because they're really keep on top about the knowledge and about the clinical expertise, and they are more open-minded for any questions. And so when I go on some courses, I prefer to do it with the foreign teachers. But yeah, manual therapy was my first courses. Then I continue for the more courses.
Yeah, but I mean the courses were ran in Croatia or in a foreign countries. So the instructors came to Croatia, or you went to travel there?
Well, I did both. I also, well, most of the time they came to Zagreb as a capital city. It's you know, more flexible for all of us to come from Croatia in the one place. And so most of those courses were in Zagreb, but also I travel outside. I traveled to Germany and Sweden, Slovenia also, Slovenia, Maribor, Ljubljana. Yeah, last year I was in Maribor and in Ljubljana for one course which is also very popular, and I recommend it also for the students, which is neuromuscular taping. I did like 13 years ago kinesio tape course, which is very similar to this one, but this instructor from Italy, he developed his own way of neuromuscular taping, and it's very interesting how it works. And so I went there also for a course in Slovenia.
Interesting. So you are doing any courses? Have you done any courses recently, or now that you are well equipped physio, you don't do any courses? So how do you approach the all around your lifetime educational process?
Yeah, I think as you as a younger than me colleagues, you don't have to push yourself that you have to finish 10 courses per year. It doesn't make sense, because of course, how you earn your money, then you invest in yourself. It's not easy to pay for 10 courses, but it's also very important that about your clinical work, that every time you spend some time, I mean few months from course to course, that you use that skills. So I think that's very important, that you give yourself some time to implement those knowledge in the physiotherapy at the place where you work. So that's also important. Sometimes it's good to repeat the same course. It's also a good idea, because it's just about refreshing yourself, because you missed something. Maybe, I don't know, maybe you was fall asleep on some of the some parts of the courses, especially after lunch. Usually you have a break for the lunch, people eat, and then first 2 hours you are mostly sleeping. So that's difficult to be focused on the course. So yeah, I think it's a good idea to refresh course. And also, especially in Rijeka, what we did, one course which is very important as sports physio, you have to know to use external defibrillator. So to you understand, yeah.
Yeah.
So this is in a case if you have emergency on the field, so you have to use the same protocol. So you have to check all the vital functions of the player, and then maybe you have to use the the basic life support protocol, which is very important. And we, as a medical team in Rijeka, we refresh every year the same course, just to be automatic. So your behavior, when something happened to somebody and somebody fall down, usually people panic. So the more often you refresh yourself, it will become automatic for you. So you will do it automatically. You will follow the protocol as a normal thing. And I'm happy that we used this protocol on one of our colleagues who really needed, and we saved his life just with the calm and calm situation, and with following those steps for the protocol.
Yeah. So we have a course on first aid now, so I can see now why it is so important. Yeah.
People usually do that basic life support just when they got driving license. So it's once in a life. I think the normal people should refresh every 5 years, because if you can save somebody's life, that's really important to know that you don't panic, because every minute is important in those situations. Like more than 5 minutes without oxygen in the brain, so the person will lose some of the functions. And after 7 minutes, it's clinically dead.
Yeah, it's important for a physio to have that knowledge also. Yeah.
Because we are most of the time with the team. So also physios, coaches, also people in a management should know that.
Yeah. Okay. Yeah, I was meaning to ask you a little bit about the how you came to United Arab Emirates. So how the opportunity came? How did you decide to work in a foreign country? Yeah, talk us a little bit. Talk us a little bit through that.
So
yeah.
My first arrival when I first came to UAE.
Yeah.
Okay. Because I see you following.
Yeah, I have
Okay.
some list of questions. I want to ask you so much that I have to be a little bit organized about it. Yeah.
So like this. Again, I got recommendation from one physio in Croatia to our national team coach, Zlatko Dalic, at that time, 2014. And then, he called me if I'm interested to come to UAE to work with his staff, because, as a coach, you change a lot of clubs. And this was once in a life opportunity that I have to grab, I had a nice life I was already 4 years in Rijeka as a physio. I was in private hospital Nemec. I just finished last few exams at the master program in Rijeka. You know, I was really satisfied. But sometimes you have to be very quick in decision, and from the day I got invitation from him, past 2 weeks that I went to UAE, and so it was also a recommendation. And then I didn't know where I'm going. I didn't know I didn't know anything about this country, so I just Google on the internet, and that's it. So I know I'm coming to the Arab world, and I was a little bit afraid, you know, another culture, another mentality, and some religious protocols also, which you have to follow. But yeah, first 3 months it was very difficult period to adapt on the another culture. But about the work as a physio, it's the same work, just on the high level. Because it is a top club in Asia, and which is competing every year in the Champions League of Asia. So yeah, the facilities and everything was amazing. We had everything what we wanted, from machines, from facilities, from materials. So it was a big surprise to me, because in Rijeka you have to think how to spare some tapings, how to, you know, really that you don't throw the small pieces. So, but here we had, I don't know, so many materials, so we can just use it really a lot. Yeah, but good experience, and that's how I finished in Align in United Arab Emirates. And first year we had really great results, and we won champion in the league, and yeah, it was fantastic. You know, first year already we took champion, and it was big result also for our future, for the future of the coach, so that we can continue to work in the same club for the next season. And then I stayed there for 5 seasons. Yeah.
Okay, 5 seasons. That's a whole lot. So, would you say that the quality of work of a physio is is on another level there, or only the equipment and facilities that enable you to work better and provide a better treatment for the players? So how would you?
I was the youngest physio with the team. Also in the same staff came a doctor from Croatia and 2 more physios, which had more experience than me. So I had my mentors already there. So they had a lot of experience in the football, in the medicine and physiotherapy. So the next season came one physio from England to be a head physio, and he was a head physio of Liverpool for 7 years. So I had a big chance to learn from high-level physio who was working in the Premier League in Liverpool, who was the head physio of Liverpool. So, you know, I catch some skills, I catch some knowledge, thinking about injuries, and it helps me a lot to have so great mentor by your side.
Of course, yeah. Do you believe that his knowledge came from experience, or do you think that physios in England are just equipped better from the faculty?
Well, he was really experienced, you know. He was I think almost 30 years working as a physio in football. So
Of course.
yeah, difficult for me to say what built him, university program or his knowledge and experience. I believe in that years that he got a lot of experience, and which is very important, because you can learn many things, but you have to build it in the practice.
Okay, so we'll jump back to Croatia and your work there on a faculty of Rijeka. So how did you decide to work on a faculty? How did you yeah, how is your work there? Do you enjoy it? Do you like it? To pass on the knowledge that you gained through all those years.
Yeah, well, then after 5 years, I came back to the football club Rijeka, and then they wrote a big news in the newspapers that I came back to develop the physiotherapy department and medical department in the club. And one day, after 2 months of my work in Rijeka, called me one professor from the faculty, and he asked me that it would be good if we can start some collaboration with the faculty for the students and everything. And I said, yeah, why not? Because when I was student, nobody gave me opportunity to come to the football club. What is a shame, because I would grab it immediately. So I think myself, I need to give opportunity to young, talented students who maybe want to learn something from me, because I didn't have that chance. I have to learn it by myself. I came alone to that private clinic when I was first year of university. I came to the door, I knocked on the door and asked, please, can I learn from you as a volunteer? So I do it that way. But I think what we did in Rijeka, we provide a system for students. So the system was that the teachers and the professors on the university, they can choose who is a talented student to come to work his practice in Rijeka football club. And yeah, it should be by recommendation, because when you are first football team, then you have a lot of ethical problems about injuries, because it has to stay inside the 4 walls. The medical data cannot leave the clubs. You cannot speak about the problems on the coffee in the city center. So we have to choose really some talented and good mannered students who can visit us. But also I teach them at the university, so some physiotherapy in the sports. It was my part of that, and also we did some skills, some taping and neuromuscular taping drills, what we did at the university. So every year I got some speeches at the university, also some practical work, and also students visit our work in the club. So it was like that, yeah.
Okay. So you are now establishing a collaboration, so between a technical faculty Rijeka on a project. Can you tell us a little bit about that? And then we'll jump to the question of the students. I'm sure they are eager to ask. Yeah.
Yeah, there was one guy who did want to do his PhD at the technical faculty about injury predictions, and that's very difficult, how to predict some injury. You should have a lot of information about the player, how, if you want to predict some future injuries, and still until now nobody can predict something more than 50%, which is not useful for football, because maybe it can be, maybe not. So but what we did, we started to build up software where we collect all the data which are available. So maybe that data can give us some new informations for the future, but you have to collect a lot of data. So many injuries, and that you can be statistically to say, yeah, these kind of injuries are recovering this long in that way, and what is the re-injury rate, so stuff like that. And we build it from zero, so nobody in Croatia have that kind of software, so we build it for free. We build it to be very simple, to be very useful for us in the club, for me as a clinical practitioner. And yeah, I'm very happy about that. And yeah, if it's 21st century, so all of the injuries we collect electronically, and everything it's in the computer. You can share it with the world, with the doctors from another clinics, and try to be really more professional.
See, and did you find success with this software?
Yes, yeah, very.
Yeah, that's really interesting. So this, I have another question. So what would be your advice to us as young physios to nurture and what to develop through their some general skills and knowledges that you find really helpful as you go on through your career? What would be your advice to us? Yeah.
Well, hope everybody of you are loving this job, and that's why you went for the physiotherapy at the university. So I think you have to find your own passion about the job, and try to push yourself, because nothing come easy. And especially university gives you a good basic, but you have to invest in your knowledge also after university, and you have to invest your money and energy and time to learn new skills in the area what you want to do. And I think that's the best way how to develop yourself in the world. Try to visit as many as you can seminars, congresses, speak with other colleagues, with the doctors, with other universities and everything. So yeah, that's important.
Thank you very much. So that's enough from me. Zara, if you have any questions, you go ahead, and others, if you have any questions to ask Marin, go ahead, please.
Okay.
Turn on your mic, and yeah.
Okay. So a few students actually wrote to me, so I'll be conducting this. Yeah. What would you say, where did you learn the most of the things you know and techniques you know? Would you say like maybe in the first few years were good enough for your first job, or did you, like, when you look back, would you say that maybe there was so much that you should have known back then?
Yeah, I think you don't have to push yourself, as I said before, to finish some extra courses immediately after university. So it's enough to do 2 courses per year, I think, maximum 3, because I believe some of the young students maybe they want to push themselves too hard, and then you don't see the clinical benefit maybe at the beginning because you are too young to understand, and so it can be tricky because you need to have some experience also together with the new courses. But also, if you don't do courses, if you don't do some extra investment in your knowledge, then maybe you will not get any benefits in the future also. So it has to be balanced, you know. I think it's not clever to do 5, 6, 7 courses per year, because you will, I mean, you will burn yourself in your head how to follow all of those knowledge, how to implement that knowledge in clinical work. If you go for a course for neurophysiotherapy and then in the 1 month you go for manual therapy course, and so if you mix a lot. Yeah.
Okay, I see. Good answer. In your opinion, what are some of the most crucial characteristics that make a physiotherapist valuable? So if you like, what makes a physiotherapist above average? Since there are a lot of us graduating the same year, what would you say is like going to keep us above the average?
I mean, there is not a shame to ask somebody if you want to learn something, because many of you're knowing, you know a lot, but maybe you are missing some details, and many of you're having a shame to ask. I think also you as a young students, how to be above average is you have to provoke the system a little bit with your ambition, with your passion, and that's it. You have to provoke the system.
Okay. Another student asked me, do you think it's worth doing a master's degree, or is it better to get a job as soon as possible, maybe a few experiences, and maybe in a few years then get back to college if needed?
Yeah, I think it's a good idea to work at the same time to be on the master also, or to do a small break, 2-3 years with the clinical work and then to go on the master. It's also not a bad idea, because I think everybody are expecting a lot. If you are a master in physiotherapy, then they think, okay, now you will fix everything, but it's not in that way. So yeah, it's just a diploma, it's just a certificate. Your patient is happy about you. Your certificate, it's telling that you're ambitious, that you really like your job and everything, but on the end, your patient need benefit from you to help him. That's it. The papers will not help.
Absolutely. What advice would you give your younger student self? Like, were you a good student? Like, is there something is your life right now the life you dreamt of as a student?
Okay, I will tell you like this. When I was teaching students in Rijeka, what I saw from a group of 30-40 students, I can say only 5 or 6 students are really motivated about it, which is shame. I believe it's maybe same in your class, because I can see it. You know, if I, as a physio who have some experience, came to the university, and if I show you some technique, it would be stupid from students to ignore that really good time to learn something. So I think you build up your career from now, even when you are a student, not when you are done with your university, because somebody from university can recommend you for some job after already. So you are build up your CV and character and everything already now.
Yeah, maybe some of us need to hear that more often. Yeah, I would agree. How do you balance your private life and your work life, since you move a lot, maybe, and with all that?
Yeah, well, that's difficult, you know. Family and private life, it's suffering, but okay, I try to time when I'm off duty to really spend a good quality time with the family and with friends. So like to charge the batteries for the next days or weeks.
Okay, yeah, that's
Yeah,
that's fair.
it depends, you know. Somebody, I like to do some sports and everything, so also it helps me to be distress.
Yeah, obviously. I think it's mandatory to have a space in your life for, yeah, of
Yeah.
your friends and everything, of course. Some colleagues of mine asked me, could you tell us more about the therapy itself with the footballers? Like, what did you do with them before the match, after the match, maybe? Yeah,
Oh,
there's
okay, well,
something.
yeah, that's very general and big field. Well, I will just give a short message, like how I worked in Rijeka when I was in charge of the clinic. So how I organize the things. So we started with injured players 2 hours before training. So 2 hours before training, injured players came to the club. Then they started the process of preparation and rehab. Then 1 hour and a half before are coming players who maybe have some kind of symptoms, musculoskeletal symptoms, and then we do exam and diagnostics of that to inform the coach about their status, if they're able to train or no. So we still have a 1 hour gap of preparing the coach for that training session, so that he can be informed 1 hour before training about the number of players, and so he can manage his part of the workloading and everything. And then 1 hour before are coming all players who are healthy and with no problem. And then we just prepare them for the training. Somebody need bandage, somebody need kinesio tape, somebody needs some soft tissue treatment, some manual therapy treatment. So yeah, and then during the training session we have a physiotherapy time for those injured players who finished the rehab. That's during the training. Then when the training is done, then we can do some more wellness treatment or preventive treatment on the players who finished the training. That's how I organize things in Rijeka.
Okay, and what was maybe the most interesting injury you healed? Is there?
Oh, yeah, that's not heavy. It happens this season. Proximal hamstring avulsion. Yeah. So you know that the hamstrings are 3 muscles. attached to the tuber ischii on the pelvis, and then of course 3 muscles are having 3 tendons. So from 3 tendons, 2 detached from the origin for more than 3 centimeters. Really, so it's avulsion in terminology of the musculoskeletal medicine. It's avulsion rupture. So it's total avulsion rupture of the proximal part. So we did complete diagnostics in 48 hours, and in 72 hours we already had a plan how to treat the player, and he went for surgery in Finland, and doctor in Finland detached the tendon back to the bone with some special technique how he do it. And then it was long process. Now it's more than 8 months, and he's coming to the team this week. I mean, he's competing. He's already 1 month and a half with the team, and now he's going to play against Celje. We have a friendly match. Yeah, Rijeka and Celje. Well, I'm not in Rijeka now, but I know that. Yeah.
Okay.
So yeah, it's really the most interesting injury until now in my work.
Okay. Wow. Okay. Yeah.
And
What are you?
to be more precise, we are speaking about high level professional footballer who is coming back. We are not speaking about the normal people. So, and he is a national team player. 2 years ago, he was national team player, 3 or 4. So we are speaking about high level athlete. That's very important. Who is coming back to the field and play match again.
Wow. Okay. What are your goals for the future? Do you have anything? Since
Yeah.
like what we've heard, you're pretty ambitious. So do you have anything else you want to achieve in your career?
Well, now I needed some extra energy, so work energy. So I came back to Dubai, to United Arab Emirates, and to work with my ex-doctor here. He's also from Croatia, in another club. And
It's 23 hours.
then I think, I'm still young. I'm still full of energy to work a lot. So I can spend a few more years here, and then maybe after a couple of years I will come back to Rijeka and open my private clinic, to a little bit set up, to a little bit calm, and to organize my weekends with family. Yeah, to that part of life, spend more with family. But you never know. I don't know. You never know. Maybe I will change my mind.
Some student asked me, did you ever regret choosing your profession, like your physiotherapy is your profession?
Yes, once. Yes. When I
What
finished,
was the occasion?
yeah, when I finished my bachelor, and when I finished 1 year of internship in orthopedic clinic Lovran, then I got one job. It was, with no offense to anyone, but it's physiotherapy in the house. When you are driving your car, you go to the houses with the patients who are having injuries or problems, and they needed physio. And then you really see a lot of social problems in the society. And then, it's once I got patient, so the client patient, as you want, who was who couldn't see and who couldn't speak. So the only thing what left to me is, you know, the touching. So the how to explain somebody who cannot understand you and who cannot explain you what he feel, what. So yeah, it was difficult. So in that period, I was just 3 months. It was a contract for 3 months, and in that period, I said myself, I won't continue this job. I will even stop physiotherapy for my life if I continue this job, because it was difficult period for me. Yeah, and then I just stopped that contract after 3 months, and then I was like 1 week at home, and immediately I got the call, and I started to be teacher in the medical school for 1.5 months. Then I got a call from Dr. Nemec in for his clinic, so I went there, and that's it. But in that period, I was thinking that I will even stop my job and physiotherapy forever. It was really heavy time.
Yeah, I think this is also the reason why most of us want to work like you in some sort of like sports physiotherapy, because you work with the
Yeah, but you have to know that yeah, many of you want to work in sports, but you have to really push yourself, and it's not easy. In sports, you don't have holidays, you don't have Sundays, you don't have Saturdays. Okay, that's very important.
One question also, if it's not too personal, was earning good income also a part of your motivation to like move and start working where you work now? Was
Sorry,
earning a good income? Okay, earning a good income, was that ever a factor in your decision making? So making a lot of money, maybe.
When I left Rijeka.
Yeah, since it's the first league and everything. Yeah.
Yeah, well, of course, I think it's one important thing that you can earn more money when you are working abroad, yeah, like here in UAE. And yeah, but you know, it's different. You don't see your friends, you don't see your family, so you have to think what is more important for you. So you are sacrificing your private life when you are leaving your family, but you earn more money, and then maybe you will give them back something material. I don't know, build a house or buy apartment or something like that. So yeah, it's if you have a good relationship with the family, then maybe that helps you to make decision to sacrifice that part of the life without them or far away from them. But then if they understand that maybe you will help them for some future. Yeah, but okay, money it's not so important if you don't feel good. So money doesn't buy you luck.
Yeah, okay, that's a good point. One last question, maybe. Did you dream of becoming a physiotherapist since you were a little kid, or when did you like know you want to become a physiotherapist?
Yeah, I wanted to be physio since I was like 10 years old, something like that. Yeah, when I was 5th grade of in the school, in the basic school, I don't know. then I already started to collect some informations about the medical school, so the high school, because I went also to for physiotherapist in the medical school, and the system in Croatia was that from the 7th and the 8th grade, you collect some points with I don't know, chemistry, physics, Croatian, foreign language, biology. You get some points to be so you can choose the school for you. So I already, you know, put more effort, for example, in my German, because I got points from that class for the school.
Okay, that's nice. So it is a bit of a dream come true after all. Is there anything else you would like to highlight, or maybe we didn't ask you and you would like to point out for us?
I just have a same message as we speak about before, that don't that you as a young students don't think that your learning and education stops after your university. That's wrong, and you have to keep learning all your life and push yourself, because every time I finish some course, I felt more motivated about my job, and that's very important. Sometimes you spend years at the same place, at the same work, without investing in yourself, and then you become boring to yourself. You know, you have your routine, and you know, you start to be how to say, yeah, boring to yourself. So then those kind of courses and seminars gave you some extra energy to keep on going with your colleagues and to enjoy your work, because you can implement that knowledge in your work, and I think it makes everybody happy if you see results of your knowledge. So I think that's my message to the young students, to don't stop learning, and yeah, enjoy your work or change.
Yeah, I think we need to realize that it's not an office job like 9 to 5. So yeah, we need to use this to like learn everything and be up to date, since everything's evolving.
And it's very simple. Use 5 to 10% of your income to invest, because it will give you back in a different way, as it gave it to me, that with my investment in my knowledge, in my courses and everything, then I got that money back when I went for a better job and everything, and it gives me multiple bigger money that I invest in myself. So if you don't invest in yourself, you cannot also think about more income.
Okay, thank you very much for being with us.
So yeah, I would like to thank you also, and I think the professor would agree. So if you travel around Slovenia, we can definitely show you around our faculty. I think professor would be keen to that.
Yeah,
so, yeah.
I would love it. Yeah, of course.
Of course. So yeah, thank you again. I think all of the students really liked it, especially this sports aspect of the physio work. So that would be all from us. Thank you very much. And yeah, thank you for being with us.